This is case 2B's presentation for Monday of management of a medically complex patient. Our group is Brittany Hudson, Mackenzie Woods, and Samuel Long. Our patient for this particular case is an 18-year-old male who received a gunshot wound to the back of his neck 1 day ago. Based on this gunshot injury, the patient received a cervical spinal cord injury at the C6 level. This morning, the patient underwent surgical expiration to restore structural integrity of the right carotid artery and the right jugular vein, as well as a screw fixation from C4 to T1. So based on this, our patient's prioritized medical problem list is hemodynamics and respiratory dysfunction, paralysis of both the upper and lower extremities, sensory dysfunction of both the upper and lower extremities, mobility dysfunction including transfers and bed mobility, as well as nutritional deficits requiring an NG tube.
So our patient presents with tetraplegia now based on after the gunshot wound at level C6. Some implications and concerns for physical therapy would be autonomic dysreflexia. We want to make sure that we're watching positioning for integumentary concerns and we're not producing any ulcers or pressure injuries. And then we also need to be aware of line management because our patient has a catheter and a central line and is also on mechanical ventilation. Based on the spinal fusion at C4T1, we are concerned with hypovolemia because the patient had significant blood loss. We want to make sure that we are protecting the surgical site. We want to be aware of motion restrictions based on the fusion and then also be concerned with infection control and monitoring that. The patient also had reconstructed right carotid artery and jugular vein. So we just want to make sure with physical therapy and movement, we are monitoring vitals at all times. We want to continue to protect the surgical site again at this area and then be aware of orthostatic hypotension with movement.
All right, next we're going to be looking at diagnostic and laboratory testing. So he has received a CT scan that shows that he has a C6 defect with through-and-through injury. The rest of his tests have been ordered, primarily looking at his complete blood work panel with metabolic and CPK values, so seeing how those lab values affect physical therapy, but also he's receiving blood and might potentially receive more blood depending on these values. Also looking at a chest x-ray, looking at his tube placement for his ventilator, but also making sure he has not accumulated any pneumonia or any fluid buildup there. Also a urinary analysis. He does have a catheter just to make sure that he is not, doesn't have a UTI or anything that would also affect other tests and measures that we might do.